My dear friends, today I am going to discuss the effect of hypertension on human body or how hypertension affects various systems of our body. Now hypertension means increase in the blood pressure. And what is blood pressure? It is nothing but increase in the lateral pressure or simply the lateral pressure exerted by the blood on the vessel while it is flowing through the blood vessel. So blood pressure is nothing but lateral pressure exerted by the blood while flowing through the blood vessel. So that is we call it blood pressure, and increase in the blood pressure above a certain range we call it hypertension. Now hypertension is one of the most common cause of or factor which is responsible for coronary heart disease. It is responsible for myocardial infarction, and it is responsible for very life-threatening condition also. So hypertension can be a life-threatening condition if it is not managed or if it is not diagnosed in right moment or if it is not controlled in right time. So most of the hypertensive patients don't know that they are suffering from hypertension because it remains subclinical without any clinical features or clinical sign symptoms. That's why it is always advised to do regular blood pressure measurement or regular blood pressure checkups to see whether the blood pressure is normal or not. So millions and billions of people throughout the world is having blood pressure and suffering from hypertension. So that's why proper care and proper regular checkup of hypertension or high blood pressure has to be done so as to prevent future complication or bad effects of hypertension on various other systems of the human body. Let's see what are the effects of hypertension on the body. First, let us start with arteries. Artery means the vessels through which blood is flowing. Now, since blood pressure is nothing but the lateral pressure exerted by the blood while flowing through the blood vessel, that's why in hypertension, surely a more amount of lateral pressure will be exerting on the arteries. So that's why we will see damage to arteries. So number one effect on vascular system is damage to arteries. Prolonged hypertension or chronic hypertension, if not managed or controlled in time with medication or natural methods, it may lead to damage to arteries, because hypertension means there is increase in lateral pressure, and lateral pressure increase means low blood velocity, and because of low blood velocity there is more stasis of blood, and because of more stasis of blood it causes damage to the lateral stress and strain on the vascular endothelium and may lead to vascular endothelial damage, and because of that chance of thrombosis also increased. At the same time, because of damaged endothelium, more cholesterol that is flowing through the plasma or blood may deposit there and lead to formation of fat plaque or plaque, and it is known as atherosclerosis. So it causes damage and narrowing of atherosclerosis over time, and it is called atherosclerosis. So in case of arteries, because of prolonged hypertension, it may lead to endothelial injury and leads to cholesterol deposition and leading to atherosclerosis. Atherosclerosis also leads to arteriosclerosis or hardening of arteries in the long run if hypertension is not managed in right moment or if it is not diagnosed at right moment. It may also lead to aneurysm. What is aneurysm? Aneurysm, it happens mostly to great arteries like aorta. So it is because of weakness in the vascular wall or vascular smooth muscle, there is a local dilatation, and this local dilatation gradually goes on rising till finally it goes on into a stage of rupture. So if the hypertension persists or if there is a higher blood pressure, the gradual aneurysm will become bigger and bigger and finally it may rupture. So hypertension, if it is not managed in right moment, it may lead to atherosclerosis. So in vessels, what it do? Hypertension may leads to narrowing of and damaging of vascular endothelium. It also leads to aneurysm, and it also leads to atherosclerosis and arteriosclerosis. Next comes the heart. What it causes to the heart? In heart, it always leads to heart failure, because when there is hypertension or high blood pressure in the systemic vessels, it creates a pressure on the heart. So heart has to pump against an obstacle or a high pressure resistance, and because of that it creates a pressure overload in the heart, and heart may go into a stage of failure. So there may be heart failure, and chronic heart failure may also leads to enlargement of left heart. So because of gradual increasing pressure on the heart, so the ventricle may enlarge, or cardiomegaly, pathological cardiomegaly may occur. So you may call it ventricular hypertrophy. So there are eccentric hypertrophy, concentric hypertrophy also, that we will not discuss here. But if the pressure persists for a long time, it create a pressure overload on the heart, so heart may dilate. We call it cardiomegaly, pathological cardiomegaly. So there is a chance of enlargement of the heart. Hypertension may also increase the chance of coronary heart disease or coronary vascular disease. So actually when there is high pressure in the blood, in the coronary vessels, these may lead to the increase the endothelial injury, coronary vascular endothelial injury, which may increase the thrombus formation and formation of blockage in the coronary vessels and lead to myocardial infarction or coronary artery disease or angina also. So in heart, hypertension, if not managed in right moment, or chronic hypertension may leads to enlargement of the left heart or enlargement of left ventricle, or known as ventricular hypertrophy or left ventricular hypertrophy. It may leads to heart failure in long run, and also it may leads to coronary artery disease, which may be complicated up to the stage of myocardial infarction and even angina. Now comes to the brain. What hypertension or high blood pressure cause to the brain? It may leads to stroke. What is stroke? Stroke may be because of hypertension or many other factors, but hypertension is the most common cause of stroke. Stroke is of two types, ischemic and hemorrhagic. Ischemic stroke occurs because of blockage in the vasculature supplying the brain, some part of brain. So vasculature blockage occurs because of formation of thrombus or decrease in the blood flow because of any reason. Chronic hypertension also leads to ischemic stroke, as well as hemorrhagic stroke also because of hypertension. Now, chronic hypertension leads to vascular dementia, which may lead to loss of memory. So vascular dementia because of is a neurodegenerative disorder which occurs because of chronic hypertension, and which may leads to memory loss. Then chronic hypertension may also leads to mild cognitive impairment or loss of function of brain due to high blood pressure for prolonged period. So in brain it leads to stroke, it may lead to dementia, or also known as vascular dementia, or it may lead to mild cognitive impairment or loss of cognitive function of brain. Next comes to the kidney. Now all of you know kidney is a vital structure, and whatever blood coming from through the systemic circulation to the kidney, it will filter it and form urine, and urine will be excreted through body. Now high amount of blood pressure or high blood pressure or hypertension for prolonged period give an effect on the kidney, and it will increase the GFR, and persistent high blood pressure may leads to kidney failure if it is not maintained, and also it may leads to kidney scarring, also known as glomerulosclerosis. So in kidney it leads to glomerulosclerosis and as well as kidney failure. Now question comes whether hypertension can lead to any effect on the eye. Yes, it is some pronounced effect on the eye. That's why ophthalmologist always check blood pressure, because hypertensive crisis may leads to blindness also. So chronic hypertension may lead to the increased retinal artery pressure and leads to retinopathy. It may also leads to choroidopathy and nerve blindness. So we should not take high blood pressure so carelessly, because it may lead to blindness also when it affects the eye. Is there any other effect of hypertension in the body? Yes, it has. It also affects the sexual dysfunction of the human body. Actually, it is responsible for erectile dysfunction in male, and in female it also leads to loss of libido. So proper high blood pressure regulation is also very much important, as it responsible for normal sex life of certain individuals. So in case of hypertension, it affects the reproductive system also. It leads to sexual dysfunction and loss of libido in female. It may also lead to peripheral artery disease. Hypertension may be lead to peripheral artery disease because of blockage in certain vascular supplying the peripheral parts of limb or peripheral limbs, leading to weakness in the limbs or pain in the limbs, and finally, if not treated, may lead to amputation of the limbs also. That's why these are better together known as peripheral artery disease, which may be because of hypertension if not managed with medication or naturally with time. Is there any effect of other effects of the hypertension? Yes, there may be effects on sleep also. Actually, persons having sleep apnea or deprived sleep or insomnia or defective sleep may suffer from hypertension. So hypertension may be associated with lack of sleep, which may further aggravate the hypertension and prone to other cardiovascular disease, stroke, and various other complications. Now, hypertension may create hypertensive some certain emergency condition. They together known as hypertensive emergency. Example is memory loss. So patient sudden memory loss may be associated with hypertensive emergency. There may be chance of aortic dissection. What is aortic dissection? It is nothing but hypertension may create increased stress and strain on the vasculature of the great wall of the artery or the great arteries like aorta, and because of that the aortic or arterial wall may rupture or may undergo disintegration, and that we call it aortic dissection. So it may lead to sudden death also, and if the patient survives also, it needs surgical repair. So we call it aortic dissection. So hypertensive emergency also leads to aortic dissection, which may lead to death also, or it is a life-threatening situation also. Stroke. All of you know stroke is also known as cerebrovascular accident or brain attack. It is because of sudden rupture of the blood vessels in the brain or because of blockage in the blood vessels of the brain. It leads to sudden death also, and or high degree of morbidity in post-stroke survivor patients. So it may be a life-threatening condition, and hypertension is one of the most common cause of or most common risk factor of stroke. Then chest pain. Chest pain may be because of hypertension also. So angina may be there. So patient may present with angina also, or patient may present with chest pain because of hypertensive emergency. Then heart attack, also known as myocardial infarction, or also known as coronary vascular disease or coronary arterial disease. So it has many names, also better known as heart attack for common man. So heart attack may be because of blockage in the arteries supplying the heart musculature, and hypertension may be one of the most common cause. And heart attack, all of you know, it maybe is a life-threatening condition, and even after a heart attack also person may go into a stage of heart failure or may survive with continuous therapy throughout their life. Next come another complication because of hypertension emergency known as pulmonary edema. Now gradual blockage, or if the hypertension persists in pulmonary artery for longer time, it may lead to pulmonary edema. So that edema is may be life-threatening because it prevents the gaseous exchange and person cannot breathe also, so there may be respiratory distress also. So pulmonary edema may be a hypertensive emergency. Another emergency situation because of hypertension may be because of kidney failure. Now I already told you that kidney failure may be because of chronic hypertension if not managed in right moment and right time. So acute kidney failure may be there because of hypertensive malignancy. So it is maybe an emergency situation. Then blindness, sudden loss of vision because of sudden rupture of the retinal artery because of malignant hypertension or hypertensive crisis may lead to blindness. So it becomes an emergency situation. Hypertension may create a problem in case of pregnancy also. We call it pregnancy-induced hypertension. The gynecologists and obstetricians, they handle the situation. We call it PIH, pregnancy-induced hypertension, or it may lead to seizure also. We call it eclampsia. So both preeclampsia and eclampsia or PIH, pregnancy-induced hypertension, may be clinical condition of concern for gynecologist. It may be also because of hypertension or uncontrolled high blood pressure. So these are the various effects of hypertension on various systems of the human body. So we know that hypertension is also known as silent killer. Yes, most of the hypertensive subjects, they don't know they are suffering from hypertension, and it remains subclinical without any clinical sign symptoms, or sometimes it may present with headache also. But most of the cases it remain asymptomatic, and which may leads to silent complication and organ problems, and it may lead to organ failure also. That's why we should not take hypertension lightly, and we should do and must do regular blood pressure checkup, and you may consult your physician how to control your blood pressure, so that you can prevent the injury of various systems of the human body or various organs of the human body day to day complications, and prevent yourself from going into a stage of life threatening situation. Thank you very much.